Have you ever struggled to find the right way to describe an injury in English? Maybe you know the everyday term, but not the precise medical name, or vice versa. Or perhaps you're preparing for the OET exam and want to sound more confident when discussing patient injuries. Well, in this lesson, I've got you covered. Hi, my name is Jer, and this is Learning English Pro, the channel that helps healthcare professionals like you excel in English and advance in your careers. Today's lesson is perfect for physiotherapists, nurses, doctors, and anyone studying for the OET. We're covering 50 essential injuries and physical conditions, from sprains and fractures to dislocations and ruptures, all explained in clear professional English. Student members can access a handy guide for this lesson in the Membership tab. It includes everything from today's video, plus exercises like my AI-generated homework to help you practice and remember what you learn. Here's how the lesson will work. I'll give you the most commonly used term for the injury, then we'll go over the proper medical name. Next, I'll explain the condition with a clear, concise definition. You'll also see visuals to help you fully understand the term. Finally, we'll look at an example sentence using natural collocations, so you'll learn the right way to talk about these injuries in a real-life medical setting. This lesson packs in a lot of information, so choose how you want to learn. Active learners, watch the full lesson in a quiet, focused space, take notes with a pen and paper, and think about which terms you're most likely to use in your work. And let me know in the comments which injuries you encounter the most. For passive learners, play this video in the background while you go about your day. This is a great way to absorb English naturally without needing to sit down and study. Alright then, let's get started. Our first condition is a broken bone. The medical term for this is a fracture. Let's take a look at our first definition. A broken bone or a fracture is a break in a bone, which may be minor, like a hairline fracture, or severe, like a compound fracture. And let's take a look at our example sentence. The X-ray confirmed that he has a fractured wrist, and he'll need a cast. Let's move on to dislocated shoulder. And the medical term is quite similar, shoulder dislocation. Our definition is when the upper arm bone or the humerus comes out of its socket. Our example sentence, he fell off his bike and dislocated his shoulder, requiring immediate treatment. Third on our list is a sprained ankle, also referred to as an ankle sprain. This is defined as a stretched or torn ligament in the ankle. She twisted her foot while running and now has a sprained ankle. Let's move on to pulled muscle. This can also be referred to as muscle strain or strained muscle. It is an overstretching or tearing of muscle fibers. Let's take a look at our example sentence. He lifted a heavy box and ended up with a strained back muscle. Our fifth term is bruise. The medical term for this is contusion. The definition is a bleeding under the skin due to a blunt injury. After falling on the stairs, she developed a large bruise on her thigh. Our next condition is a swollen knee. In medical terminology, this is known as a knee effusion. It is a fluid buildup in or around the knee joint due to injury or inflammation. His knee is swollen after the accident, and the doctor suspects ligament damage. Let's move on to a torn ligament. You can tear a ligament in lots of different places. One common type is known as an ACL tear. It is a tear in the ACL, which of course is a ligament in the knee. Our example sentence is, the footballer was sidelined for months after an ACL tear. Let's move on to torn cartilage. There is cartilage in different parts of the body. One common type of torn cartilage is a meniscus tear. This is damage to the cartilage in the knee, often caused by twisting. He needed surgery to repair a torn meniscus. Our ninth term is a cracked rib. In medical terminology, it would be known as a rib fracture. This is a break or crack in one of the ribs, usually caused by trauma. She has a cracked rib from the car accident, but it will heal on its own. Let's move on to frozen shoulder, also known in medical terms as adhesive capsulitis. This is a stiffness and pain in the shoulder joint, leading to limited movement. Let's take a look at our example. He developed frozen shoulder after months of inactivity. Our next condition is sports related, a tennis elbow. Also known as lateral epicondylitis. It is an inflammation of the tendons in the elbow due to overuse. His doctor diagnosed him with tennis elbow from repetitive lifting. A similar condition is golfer's elbow. This is known as medial epicondylitis, and it is an inflammation of the tendons on the inside of the elbow. Let's take a look at our example sentence. The patient complained of pain due to golfer's elbow. We are already on our 13th term, which is a slipped disc. In medical terms, this would be known as a herniated disc. And it describes a spinal disc that is moved out of place, pressing on nerves. He has a herniated disc causing severe back pain. Next up, we have whiplash. This is also known as cervical strain. It describes a neck injury caused by sudden back and forth motion, often from car accidents. After the car crash, she suffered from whiplash. Let's move on to concussion. In medical terms, this could be called a mild traumatic brain injury, or an MTBI. This is a temporary loss of brain function due to a head injury. Let's take a look at our example. The boxer was taken to the hospital with a concussion. A common injury is a black eye, also known in medical terms as a periorbital hematoma. This is a bruising around the eye due to impact. He got a black eye after being hit in the face. Our 17th condition is a burst appendix. In medical terms, it might be called a ruptured appendix. This is a life-threatening condition where the appendix bursts, leading to infection. She was rushed to surgery for a ruptured appendix. Let's move on to collapsed lung, medically known as pneumothorax. This is where air leaks into the chest cavity, causing the lung to collapse. A severe injury caused a collapsed lung, requiring immediate treatment. Next, we have a gunshot wound. In medical terms, it might be called a ballistic trauma. And of course, this is an injury or a wound caused by a bullet or firearm. The patient arrived with a gunshot wound to the shoulder. A deep cut is another condition, also known in medical terms as a laceration. This is a deep tear or cut in the skin. The kitchen knife accident left him with a deep laceration on his hand. Let's move on to a burn, or in medical terms, a thermal burn. This is damage to the skin caused by heat, fire, or chemicals. The chef suffered a second-degree burn from boiling water. A similar condition is sunburn. This is also known as radiation burn, and this is skin damage caused by excessive UV exposure. After a day at the beach without sunscreen, she got severe sunburn. Our next condition is the opposite of sunburn, frostbite. And frostbite is what it would be known as in medical terms. This is tissue damage caused by extreme cold, leading to numbness and discoloration. Let's take a look at our example. The hiker developed frostbite on his fingers after being stuck in the snow. Let's move on to a nosebleed, in medical terms, epistaxis. This is bleeding from the nose due to injury or dry air. He had a nosebleed after getting hit in the face during the game. Next up, we have knocked out tooth, known medically as an avulsed tooth, and this is where a tooth has become completely dislodged from its socket. The boxer had a knocked out tooth and needed immediate dental care. Another common dental condition is a chipped tooth, known medically as a dental fracture. This describes a small break or crack in a tooth. She bit into a hard candy and ended up with a chipped tooth. Condition number 27 is a split lip. In medical terms, it's known as a lip laceration, and this describes a deep cut or tear in the lip. He fell off his bike and ended up with a split lip. Next up, we have stab wound. This can be known medically as a penetrating trauma and describes a deep wound caused by a sharp object. Our example is, the paramedics treated a patient with a stab wound to the abdomen. Let's move on to punctured lung. This can also be called a traumatic pneumothorax. It describes a lung injury where air leaks into the chest cavity. The patient had a punctured lung due to a fractured rib. We are already at number 30, internal bleeding. In medical terms, this would be called a hemorrhage, and it defines bleeding inside the body, often due to trauma. Let's take a look at our example. The car crash victim showed signs of internal bleeding and needed surgery. Next up, we have a swollen lip. In medical terms, this would be called a lip edema. It describes a swelling of the lips due to something like an injury or an allergy. After the allergic reaction, his lip was swollen and painful. Next, we have sprained wrist, or a wrist sprain. This is a stretched or torn ligament in the wrist. She slipped on ice and ended up with a sprained wrist. A jammed finger can also be called a finger sprain. This is an injury to the ligaments in the finger due to impact. He jammed his finger playing basketball and now it's swollen and stiff. Let's move on to the nicely named turf toe. Better known in medical circles as metatarsal phalangeal joint sprain. This describes a sprain of the big toe. It's common in athletes. And our example sentence is, the footballer was sidelined with turf toe after a rough tackle. Our next condition is one I have suffered with myself, shin splints. Medically, it is known as medial tibial stress syndrome. It describes a pain along the shin bone due to overuse. The new runner develops shin splints from training too hard. An Achilles tendon tear is also known as an Achilles tendon rupture. It describes a complete tear of the Achilles tendon, which connects the calf to the heel. He collapsed in pain after an Achilles tendon rupture during a sprint. Number 37 is a rotator cuff tear, also known as a rotator cuff injury. It describes a tear in the muscles or tendons of the shoulder. The swimmer was diagnosed with a rotator cuff tear and needed physical therapy. Let's move on to a boxer's fracture. In medical terms, a fifth metacarpal fracture. This is a fracture of the hand bones, often caused by punching a hard object. He broke his hand in a fight and was diagnosed with a boxer's fracture. Next up, we have groin strain, also known as adductor muscle strain. This describes an overstretching or tearing of the muscles in the groin area. Let's take a look at our example. He had to stop playing due to a groin strain. Let's move on to blister. This can also be known as a friction blister. It is a fluid-filled bubble on the skin caused by friction or burns. She developed blisters on her feet from wearing new shoes. The term bed sores can also be referred to as pressure ulcers. These are skin wounds caused by prolonged pressure, common in immobile patients. The nurse treated the elderly patient's bed sores with special dressings. Next, we have ear barotrauma. In medical terms, this would be known as barotitis media. It describes damage to the ear due to sudden pressure changes. He experienced ear barotrauma while scuba diving. Our next term is dehydration. In medical terms, it can also be known as hypohydration. And of course, this is a condition where the body loses too much fluid. The marathon runner suffered from severe dehydration. Our next type of injury is an electric shock. You might hear this referred to as an electrical burn or electrocution, and it's defined as an injury caused by contact with electricity. Let's take a look at our example. The worker was rushed to the hospital after an electric shock. Condition number 45 is a broken nose, also known as a nasal fracture. This is a break or crack in the bones of the nose, often caused by impact. The rugby player suffered a broken nose after a head collision. Let's move on to a hip fracture. In medical terms, a femoral neck fracture, and this describes a break in the upper part of the thigh bone. The elderly woman needed surgery after a hip fracture. Compartment syndrome, or acute compartment syndrome, describes pressure in a muscle area, cutting off circulation. Let's take a look at our example. The patient needed emergency surgery for compartment syndrome. Our next injury is an eye scratch. In medical terms, this could be known as a corneal abrasion. It describes a scratch on the eye's surface, causing pain and redness. The doctor prescribed eye drops for his corneal abrasion. Number 49 is a blood clot. There are lots of different types of blood clot. Today we'll cover deep vein thrombosis, or DVT. DVT is a clot in a deep vein, usually in the legs. He was diagnosed with deep vein thrombosis after a long flight. Our final condition is seizure injury, known as a postictal injury in medical terms. This is a trauma caused by uncontrolled body movements during a seizure. Let's take a look at our final example. He bit his tongue due to a seizure injury and required medical care. Well done, you've made it to the end of this lesson, and that's a huge achievement. Learning medical English takes time and practice, and you're doing great. To get the most out of this lesson, I recommend repeating the lesson. Repetition is key to remembering new vocabulary. Practice the terms by saying them out loud or writing them in sentences. Share this lesson with a colleague or friend and have a chat about it. This is a great way for both of you to improve your English around this subject. If you found this lesson helpful, hit the like button, subscribe to the channel, and leave a comment below. Let me know which term you think you'll be using first. Thanks for watching, and if you'd like to learn more medical English, check out this lesson on 500 English phrases for nurses. I'm Jer, this is Learning English Pro, and I'll see you in the next lesson.